Hello, my name is Lucia Ferrer, and I'm a fourth-year undergraduate student in the UCSD Global Health Program. My research interests and what I've covered on this poster include the medicalization of childbirth and how that process is affected where women decide to give birth. Previous literature has included either quantitative analyses of birth data or qualitative measures of individuals involved in the birth process. Few have integrated both to examine how they combine to produce the effects on childbirth we see today. Those effects include nearly 99% of births in the United States occurring in the hospital, despite evidence showing comparable or better safety rates in other settings like a planned home birth or in a freestanding birth center. Hospital births see high rates of labor interventions compared to planned home births, as depicted in this graph in the middle, as well as little power granted to pregnant women. As an example, the WHO and the CDC recommend that the C-section rate be between 10 and 15%. Despite this recommendation, the United States C-section rate is nearly 32%, even though mortality rates for both maternal and infant increase when C-section rates surpass this threshold. So why do we continue to regard biomedical institutions as the epitome of safety? Are there groups for whom the success of hospitals is favorable, like private health insurance companies, doctors working under a fee-for-service payment model? So I've identified 4 factors that influence a woman's decision, the first being healthcare structures. So the US spends more than any industrialized country on healthcare, but has one of the highest rates of both infant and maternal mortality. Additionally, how does cost of birth, either surgical or natural birth, affect what is recommended by practitioners in a hospital? The second is medical and bodily autonomy. So anecdotal evidence shows that women's rights to informed consent are routinely ignored during childbirth. The third is safety and risk perception. So how does your cultural background affect what you value during the birth process? And the last is racial disparities. So Black, Indigenous, and Hispanic populations received worse care than white populations in 35 to 40% of healthcare quality measures. And this extends to the obstetric field, where the infant mortality rate is highest for Black infants, 11.41 deaths per 1,000, and compared to 5.19 deaths per 1,000 for white infants. So the 4 described societal structures become embodied in a woman's worldview and influence and limit her decision about the birth setting. So how does private healthcare limit her choices for where she could actually give birth? What aspects of her birth will be accepted by her insurance? And will her physician actually allow her to accept or turn down procedures? And more broadly, what can this tell us about our say in our own healthcare or the transparency of medical practitioners with their patients? Thanks.